This is
Make It Plain.
Make It Plain.
MIP
With Masamela Matfumo.
Mark Thompson.
Make It Plain.
Get woke.
Ladies and gentlemen, we're honored to be joined, and I think I have these numbers right. He was the Surgeon General twice, correct? This is his second appointment as Surgeon General, and we're happy to have him. I think this would make him the 21st Surgeon General of the United States. Dr. Vivek Murthy is with us. Dr. Murthy, how are you today?
I'm doing well, Reverend Mark. I'm glad to be together, even though it's virtually. And but I've got my health, I've got my family. I'm blessed, so can't complain.
Wonderful, wonderful. Now, there's a new level of concern around this Delta variant, isn't it?
There is, absolutely.
Tell us about that, what it is and what that could mean.
Well, Reverend Mark, the Delta variant is a version of COVID-19 that's different from what we've seen before. It is more transmissible than any of the prior variants. And there is also some concern that it may be more dangerous in terms of causing more severe disease. More data still needs to come out on the latter point, but we do know that this is more contagious. And that has real implications for people who are not vaccinated in our country, because we're already seeing that the Delta variant is surging in terms of the percentage of cases that it makes up in the United States. It's doubling every 2 weeks, in fact, and it's driving outbreaks in parts of our country where vaccination rates are low. The good news, though, is that if you are vaccinated, you are largely protected from the Delta variant. And that's wonderful news. And that's data that we have coming out of the United Kingdom, which has now been completely overtaken by the Delta variant in terms of their COVID cases. But it shows us that you get fully vaccinated, you've got good protection. If you don't have the vaccine in your system, though, you are more susceptible than ever to COVID-19. And that is my big concern.
Yeah. Have we gotten a little complacent? I mean, there's nothing but good news these days. People are getting vaccinated. People are back out. I'm actually visiting Atlanta. And last night I went to the Braves' new stadium and it was wall to wall, no masks, nothing. Are we becoming complacent to the point where we're probably not as aware of the Delta variant or anything else that might still be out there?
So I do worry, Reverend Mark, that with all of the progress that we've made, that some people are taking this good news, and good news coming in the form of cases coming down, hospitalizations coming down, deaths coming down, to mean that COVID is over, that the pandemic is behind us. Yeah. But it's not. And we're actually seeing that in many parts of our country where vaccination rates are low, that some of them are starting to see now an uptick in infections. And we're still losing almost 300 people a day to this virus. So it is not in the rearview mirror, even though we've made progress. And what we've seen, Reverend Mark, time and time again, is when we get complacent, this virus takes advantage of us, right? We've seen that over the past year, that the virus dips in terms of the number of cases, and people start to come out and think this is over, and then we have another surge. So it's really important that we stay vigilant, and most importantly, that we get vaccinated. We are starting to see a tale of two Americas, right. Those who are vaccinated, who are protected, those who are not, being susceptible to the virus, including these new variants. We can't afford to let that kind of divide grow in our country, which means we've got to keep these efforts up and not only vaccinate ourselves, but we got to get other people vaccinated. So if you've already done the job of getting protected against this virus, talk to your family, talk to your friends, reach out to them and ask if they have questions about the vaccine. If they do, have them go to vaccines.gov and get information about the vaccine and about where to go to get vaccinated. That's how we can come together, save lives, and end this pandemic.
Yeah, no question about it. More MIP after this message.
What up, y'all? It's Torre, author of I Would Die For You, Why Prince Became an Icon. And in just a few weeks, we're going to drop an epic 8-episode podcast about Prince called Who Was Prince, where we talk to his girlfriends, his musicians, his engineers, his managers, all sorts of people who were close to him to find out who he really was. Who was Prince? Find out on June 21st. In the meantime, follow Who Was Prince wherever fine podcasts are streamed.
More MIP after this message. Are there any commonalities or traits in those areas or in those populations, General Murthy, where people are not getting vaccinated? Is there something about that is making those individuals continue to not do it? Or are people think, well, everybody else is vaccinated, I don't have to anymore? What are you finding?
Well, it's really interesting you asked that question, because I think one of the common denominators here is misinformation. We're finding that 2/3 of those who are not vaccinated either believe common myths about COVID-19 or think that those myths might be true. And these include myths like, if I get the COVID vaccine, I might get COVID. That is not true. You don't get the virus from the vaccine. The vaccine doesn't actually have the virus inside of it. They also include myths like the vaccine might cause infertility or mutations in my DNA. And to be very clear, there's absolutely no evidence that that is true. There are plenty of people who've had the vaccine who have actually gotten pregnant, many who have gotten the vaccine during pregnancy and done just fine. What we do know for sure is the vaccine prevents you from getting COVID. And we've learned over the last year that getting COVID is no simple proposition. Not only have we lost more than 600,000 brothers and sisters in America to this virus, but we've also found that for those who have survived, many have had to go through severe disease and hospitalizations. Many have suffered with longer term consequences called long COVID, where they've had shortness of breath or fatigue or chest discomfort for months and months following their infection. So we know the downside of getting COVID. We're blessed to have a vaccine, several vaccines in our country that help prevent those terrible consequences. That's why we've got to stay vigilant, get vaccinated, and that's how we're going to turn this pandemic around.
Last question, General Murthy. Are we going to need to get boosters? Do we know yet?
So the short answer is we don't know yet. It's possible that we might. And we are following cohorts of people who have received the vaccine to understand one critical thing: how long does their protection last? And what we've seen is at the 6-month mark, it appears that protection is still holding up. That's great news. And so we'll keep following people. But when it becomes clear that protection is starting to decline, and if infection is starting to rise, at that point, we will spring to action to make a recommendation about boosters. I don't anticipate that happening anytime, in the next few weeks or so. And so we don't know. Is this going to be 3 months down the line, 6 months down the line, a year down the line? Time will tell, and we will keep the public posted.
Indeed. Well, we thank you for your service. Folks, Surgeon General of the United States, Dr. Vivek Murthy, thank you, sir, for joining us and informing us. He's saying, folks, this Delta variant is real. And if you're not vaccinated, you will continue to be susceptible. So now is not the time to relax just yet. Please get vaccinated. Please protect yourselves and your loved ones. Thanks again, Mr. Surgeon General.
Thank you so much, Reverend Mark, and take care for everything you're doing. And thank you, I should say, for everything you're doing to help keep communities informed about COVID and the vaccine. It's incredibly important right now.
At your service, sir. Appreciate you. All right. Thank you, man. Thanks for getting woke and listening to Make It Plain. Please remember to listen, like, and wherever you get your podcasts, please give the show a 5-star rating. And please do spread the word. Let's all continue to pray for each other during this pandemic and this police-demic. If all hearts and minds are clear, it has been made plain.